Hello, this review will be going over F2 Exam 2 Study Guide. Starting with Chapter 25, Fluid, Electrolyte, and Acid-Base Balance in the Fundamentals textbook. Know and understand the causes of acid-base imbalances. For example, diarrhea can lead to metabolic acidosis, vomiting can lead to metabolic alkalosis. So we can find that information very well organized on a table in page 456. Table 25.5, acid-base imbalances. You can see here the 4 different imbalances that you can have, which are respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. Then you can also see the causes, the things that will cause them, signs and symptoms, and the arterial blood gas values that you would use to identify them. So knowing the information on that table would be very helpful for some of the questions that you're going to see on your exam, most especially about the acidosis imbalances. And that's page 456. What does it mean when a fluid is isotonic? So we're going to go back to the We're going to go to page 447 for that, and you're going to see the isotonic. It's going to be the blue key term on that page at the bottom of the page. When living cells are surrounded by a solution that have the same concentration of particles, the water concentration of the intracellular fluid, or ICF, and ECF will be equal. These solutions are termed isotonic. That means of equal solute concentration. And that's page 447. Why are the elderly and infants at a higher risk of dehydration? So we're going to go back to the beginning of the chapter for that on page 445. The infant and the older adult are affected more quickly and seriously by minor changes in their fluid balance and can become rapidly dehydrated. And that's the bolded text. What are non-electrolyte products? And be familiar with electrolytes. Non-electrolytes can be found on page 446. It's going to be the first sentence under that heading. The intermediate products of metabolism, amino acids, proteins, glucose, and fatty acids are the non-electrolytes. So those are our non-electrolytes. On page 446 as well, you have table 25.2. That's going to have your major electrolytes, their normal range and function. So we should recall a lot of that information from previous chapters that we've gone through. So that should be a little bit of a recall for you. You can also find some information about the electrolyte imbalances specifically on pages 451, 452, and 453. And you would want to pay very close attention to sodium and calcium when studying. Sodium, calcium, and potassium. What are some symptoms of hypokalemia? So you can find some symptoms of hypokalemia on page 452. Within the table, there are signs and symptoms of hypokalemia. With what electrolyte imbalance would the nurse expect to find a Chvostek sign? So we can find that on page 452 in that same table, 25.4, right under hypocalcemia. So that would be the imbalance that you would expect to see a positive Chvostek sign, and that is going to be a twitching of the cheek when you were to touch and kind of irritate the cheek right there. So you would touch and the cheek would twitch, that muscle. If a patient has insufficient intake of vitamin D, what other electrolyte will be affected by this? So that's also going to be calcium, and you can find that information in that same table. Inadequate dietary intake of calcium and vitamin D. And we know that because we need calcium D in order to be able to absorb and process our vitamin D. How do the kidneys concentrate urine when a person is dehydrated? So we can find that information on page 447. More ADH is released when the blood becomes more concentrated. Circulating blood volume is decreased, or the person is experiencing nausea, pain, or stress. With increased ADH, the renal tubules reabsorb more water, and urine output will decrease. And that's page 447. What substances move by diffusion throughout the human body? We're going to find that on the same page here, 447. Glucose, oxygen, carbon dioxide, water, and other small ions and molecules move by diffusion. What type of acid-base imbalance would the nurse expect to see in a patient with COPD? So we would expect to see that in respiratory acidosis, and you can see this on the table 25.5 on page 456. Respiratory acidosis can be due to COPD. So again, a lot of questions from these tables here in this chapter. What is a temporary intervention the nurse could suggest to a patient who is hyperventilating? So we can find that information on the next page, page 457. Hyperventilation is a rapid respiratory rate. This results in respiratory alkalosis. Treatment for hyperventilation is to treat the underlying disorder. The person can breathe through a rebreather mask temporarily, mixing the excessively exhaled carbon dioxide with oxygen so that the carbon dioxide is inhaled. So the nurse could go ahead and put that patient on a non-rebreather mask, so that they would be able to breathe throughout, or place them on a rebreather mask so they would be able to breathe in and out within that bag. Or you could even have them take a paper bag and put it over their mouth just so they can breathe in and out their own oxygen and carbon dioxide. So page 457. Define active transport. So you can find that information on page 448. Active transport is a force that moves molecules into cells regardless of their electrical charge or the contractions already in the cell. It can move substances from an area of lower concentration to an area of higher concentration using adenosine triphosphate or ATP. Page 448. What is an important consideration when obtaining a patient's daily weight? For that, we're going to go on to page 458, and we're going to look at the assignment considerations and the clinical cues. Daily weight. When assigning the measurement of daily weight, remind the unlicensed assistive personnel, or UAP, that the weight needs to be measured at the same time every morning, with the patient in the same clothing on the same scale, after they avoided and before eating. Otherwise, accurate measurement of weight gain or loss is impossible. Ask the UAP to report to you any change of more than 1 kilogram immediately. And in the clinical cues, a weight gain or loss of 1 kilogram, which is equivalent to 2.2 pounds, in about 24 hours will indicate a gain or loss of 1 liter of fluid. So that would answer both of those bullet points. What's an important consideration of obtaining their daily weight? And then also, how would you interpret a 1 kilogram weight gain in liters? You would interpret that as a 1 liter weight gain. How can the nurse use blood pressure measurements in various positions to evaluate fluid volume status? So we'll remember that this is called our orthostatic blood pressure readings, and you can find that information on page 459 in the clinical cues purple box. To assess for a fluid volume deficit, measure the blood pressure and pulse in the lying, sitting, and standing positions. If the systolic pressure drops 20 milligrams of mercury, or diastolic pressure drops 10 millimeters of mercury, accompanied by a pulse rate increase of 20 beats per minute at 1 minute after that position change, you would expect to determine that a fluid volume deficit would be present. So according to your textbook, it's 20 and 10. But within the hospital, we look for a 30-point difference within either the systolic or diastolic, as well as the pulse. But 20 would also be considered significant, and you would report that information as well. And that is our orthostatic blood pressures, and you assess the pulse with that as well. Be familiar with common equivalents of food container measurements and be able to apply them to calculation scenarios. For example, if the patient consumed 1 cup of coffee, 1 cup of juice, and gelatin for breakfast, how many milliliters of liquid did he consume? So you can find that information on page 461. It's going to be in table 25.8, common equivalents of food containers. That's going to have everything that you need right there to calculate how much, if those items were on a tray, how much they were. So let's say that the patient did consume 1 cup of coffee. That would be 240 mLs. And then they also consumed 1 cup of juice. Okay, so that's 120 mLs. And they had some gelatin for breakfast as well. That's considered 80 mLs. So that's going to be an overall amount of 440 mLs for breakfast. So you could expect to see a question similar to that on your test, and you would want to be familiar with those common equivalents of food containers. And again, that's going to be information that will help you later on in clinical as well, because it's very common that we have to convert coffee cups and juice and styrofoam cup amounts into mLs in order to chart them. Page 461. Would the nurse record IV fluid as intake? How is this calculated per shift? Yes, we absolutely do record it as intake, and you can see that on page 460. IV fluid infused is recorded as intake. At the beginning of the shift, during the handoff report, note how much is left in an IV container that is in progress. Another IV container may be started during your shift when the old one is totally infused. By adding and subtracting, you can calculate the total amount of IV intake. For example, suppose that your patient has 350 mLs remaining in their IV bag at the beginning of your shift. It finishes, and you hang a new bag at 1 p.m. At the end of your shift, there's 200 mLs left in that bag that you hung earlier. Add the 350 and 200 for a total of 550 mLs of IV intake for the shift. 200 mLs has infused from the new bag, so you have 800 left over, and you've given them 200. So you take the 350 that was hanging from before, the 200 that's gone in since you hung that new bag, and that has a total of 550 mLs of IV intake for that shift. You would enter that amount on the intake and output record as intake under the IV column. So that should also be a little bit of a refresher from our dosage and calc. A couple questions like that on the test. How would the nurse schedule fluid allowances for a patient on a fluid restriction diet? So we can find that information on page 461. The patient with a fluid volume overload may have an order for fluid restriction. This means that they may have only a certain amount of fluid over a 24-hour period. Work out a schedule of fluid intake so that liquids are spaced evenly and the patient does not receive all of the allotted liquids in a short time. A typical schedule would be day 600 mLs, evening 400 ml, and night 200 ml. If not prohibited, hard candies and chewing gum can help relieve thirst. Frequent oral care is essential. And that's page 461. And we're going to go ahead and continue on to the next chapter, and I will be posting the answers to the pretest in another document. Chapter 26, Concepts of Basic Nutrition and Cultural Considerations. What does saliva begin to break down? So this is again going to be a review from Structure and Function, and you can find this information on page 467. Saliva plays a role in the chemical digestion of starches, carbohydrates. Where is vitamin B12 absorbed? Again, this is a review. Vitamin B12 we know is absorbed in the stomach through the action of intrinsic factor, which is secreted from the stomach wall. According to the American Heart Association, how much cholesterol should a person have per day? You can find this information on page 469 in box 26.1, American Heart Association 2015 Diet and Lifestyle Recommendations. Reduce foods high in dietary cholesterol. Aim to eat less than 300 milligrams of cholesterol each day. What is the only plant source that contains all 9 essential amino acids? We can find that information on page 471. Soybeans are a legume high in protein and contain all 9 essential amino acids. How would the nurse help the patient determine their daily protein requirement, know the formula, and be able to use it in a scenario problem? Well, on page 471, you can find that formula. To determine the protein requirement per day for a healthy adult, calculate as follows. Weight in pounds divided by 2.2 to achieve their weight in kilograms. And we will remember that 1 kilogram is equivalent to 2.2 pounds. You take their weight in kilograms and times it by 0.8. That will get you the amount of grams of protein that they need per day. So knowing that formula will be important to use for one question within your test. Being able to take that weight, convert it to kilograms, something that will be a review from our dosage and calc, then taking that weight in kilograms and remembering to times it by 0.8. That will get you your grams per day that that person needs of protein. What type of nutrients could the vegan patient be deficient in? We can see that also on page 471. Vegans in particular may have a diet deficient in vitamin B6, vitamin B12, iron, zinc, calcium, riboflavin, and vitamin D. What are some natural changes in the digestive system that occur with aging? We can find that information on page 468. Decreased muscle tone at sphincters may increase heartburn or risk of esophageal reflux. Are simple sugars a good source of energy for the body? Why or why not? Not really. And we can see that information on page 472. Although simple sugars cause a quick rise in blood glucose, the level falls rapidly and can result in a return to a hunger state. How much fiber should the adult consume in a day? What are some good sources of fiber that the nurse can recommend to the patient? You can find that information on page 473. Health experts recommend 21 to 38 grams of fiber per day for adults. Fiber content in the diet can be increased by such practices as replacing white bread with whole wheat bread and white rice with brown rice, or eating whole grain cereals and pasta. Increasing intake of fresh fruit and vegetables, beans, and peas will also increase your fiber intake. Then also on page 473 in table 26.1, you can see fiber content of selected foods, and it would be important to focus on the fruits and grains section of that table. Take note of the fat content of various foods in the table on page 475. Which foods would be appropriate to recommend to a patient who is limiting their cholesterol intake? So on page 475, we do see a big table here, table 26.2, labeled fats. So look at the fat in the meats, in beef, bacon, ham, pork chops, and chicken with skin. And, see which ones of those have the most fat or the fewer fat, and which ones would be most appropriate to recommend to a patient. And then also to take a look at the fish and some of the total fat content of the fish that you see there, because those could also be really good meats to recommend, well, not really meats, but different types of protein options that you could recommend to your patient. So I would focus on the fat in the meat and the fat content in grams in the fish in that table. Which food source is best to maintain a consistent blood sugar level? So that is, of course, going to be our complex carbohydrates or starches, and you can find that information on page 472. Starches provide a more consistent blood glucose level than simple sugars do. What two things cannot be eaten at the same time according to Judaism? So we can also remember this kind of as a refresher from our previous exam, but that is going to be milk and meat. And you can find that information on page 480. Judaism faith does not include meat or milk at the same meal. What are some characteristics of the traditional African American diet? You can see that information on page 480. These preferences often contribute to high fat, sugar, and salt content in the traditional African American diet. What is a good recommendation for an infant's first source of solid food? You can find this information on page 481. Solid foods should be introduced gradually, one item at a time. A single grain cereal, such as rice or oatmeal, is a good initial choice. What are some strategies to help a toddler eat their meals? We can find this information on page 482. Parents can use some of the following guidelines to assist toddlers to eat. Avoid combination foods. Toddlers prefer single-item foods that do not touch each other on the plate, and include finger foods for active toddlers. What are some strategies to help improve nutrition for the older adult? We can find this information on page 484. Families can prepare meals that can be frozen and easily heated by older adults. Another concern for older adults living alone is senility. Many older adults with memory loss may not remember eating or may not eat for long periods of time. Family intervention to provide supervision of meal preparation and eating can help ensure that that person is eating nutritionally and preparing their food safely. Page 484. Also be sure to look at the improving nutrition of older adults in the patient education blue box on page 484. Preparing several portions of the favorite foods at one time and placing those foods in the freezer containers for easy reheating would be an excellent strategy that families could assist with. And then serving food in an attractive setting, even when eating alone. So, families may be coming over and assisting with making, that area enjoyable to look at. The nurse needs to be sure that what items are not on the meal tray for a Muslim patient. You can find that information on page 480 again. Islam. In the Islam faith, no pork or pork products and no alcohol should be on that tray. When having a hard time providing nutrition for a patient, what is an appropriate intervention or consult? Well, of course, it would be appropriate to consult with or refer patients to a dietitian or nutritionist to provide foods the patient will find acceptable to eat. Allowing the family to prepare and provide food for the patient can be a means to ensure proper nutrition. Family members can also be advised of any restrictions that are required because of their specific medical needs. And you can see that in page 480 in the purple clinical cues box. You can also see that information on under nutritional counseling. The nurse and dietitian can help patients modify diets to meet their nutritional requirements. Dietary counseling should include modification of the culture's traditional diet to accomplish a healthier composition and preparation while maintaining the diet's basic components. And that's on page 481. And that is also the answer for when visiting the home of a confused patient at risk for a nutritional deficit. Who would you want to direct your education to? That would be the family or the caregiver who is going to be taking care of that patient. Telling them the strategies that they can do to help with that, to make sure that they're preparing food safely. That they could maybe make extra meals for them, put them in the freezer, so on, those different tips that we've just mentioned. So same thing with that clinical cues box on page 480, and then under the nutrition counseling on page 481 for those last two bullet points there. Chapter 27, Nutritional Therapy and Assisted Feeding. What is an important safety consideration that needs to be checked prior to serving the patient their food tray? So we can find this information on page 492 in Skill 27.1, Assisting a Patient with Feeding. Planning, number 2. Check the diet on the tray with the diet sheet. Ensure that the patient receives the correct diet. After assisting the patient with eating their meal tray, what should the nurse do next? We can see this on page 494 in that same skill, under documentation number 15. Document the amount and type of food consumed during the feeding and the patient's response. Documents nutritional intake and how it is tolerated. Communicate progress to the healthcare team. An example, 216, 1200, fed lunch, ate 50% of meal, had difficulty chewing and swallowing meats, occasional coughing. What is a strategy to assist the oriented but visually impaired patient to eat their meal tray? So I'm sure you guys will all remember this from a previous skill, and you can find this information within the skill on page 493 under the visually impaired patient, number 12. For the patient who is visually impaired but able to self-feed, describe what foods are on the plate and tray. Orient the patient to the position of the foods on the plate by describing the plate as if it is a clock face with particular foods positioned at, for example, 1200, 3 o'clock, 6 o'clock, and 9 o'clock. Your patient is on a clear liquid diet and asks you for something to eat. What can you grab them from the nutrition room? So you can find this information on find this information on page 495 in box 27.1, full liquid and clear liquid diets. So foods allowed on a clear liquid diet, you would want to pay attention to those foods. What should the nurse include in the treatment plan for a patient with bulimia nervosa? We can find this information on page 496. Bulimia nervosa is an eating disorder that is characterized by episodic binge eating, followed by behaviors designed to prevent weight gain, including purging, fasting, using laxatives, and exercising excessively. The treatment plan may include nutritional supplements and monitoring of patients after eating to ensure that purging does not occur. Page 496. How much weight should an overweight woman gain during pregnancy? So you can find this information on page 497 in table 27.1, recommendations for total and rate of weight gain during pregnancy by pre-pregnancy body mass index. In that table, you can see that for an overweight woman, she should gain in total 15 to 25 pounds of weight gain. So to remember that for studying, I would just remember right in the middle and go ahead and remember 20. So an overweight woman can gain about 20 pounds of weight appropriately during their pregnancy. Healthy, I guess I should say. Healthy weight gain. What is a common deficiency in the patient who abuses alcohol? So that is going to be thiamine, and we can find that information on page 498. It's going to be in the bolded text. Thiamine deficiency is often present with alcohol use. What does it mean if the patient has high HDL cholesterol? Is that good? What about high LDL cholesterol? Is that good? So we can find that information on page 498. High density lipoprotein, or HDL cholesterol, is known as good cholesterol. So what does it mean if they have high HDL cholesterol? Well, that's good. That's a great thing because that type of cholesterol will cleanse the vessels of the fatty deposits. So we like that. High HDL is just fine. That's great. What about high LDL cholesterol? Well, LDL is low density lipoprotein. That increases the fatty deposits on the vessel walls. Well, that's not good. We definitely don't want increased, fat on our vessel walls. So high LDL is bad. High HDL is good. Page 498. What is a normal acceptable blood glucose level in an adult? What about a diabetic adult? You can find that information on page 499. The goal of nutritional patients with diabetes is to control the amount of carbohydrates in the blood glucose at a level of 70 to 120 milligrams per deciliter. And in a patient without blood glucose, you would expect it to be below 100 for fasting and you would expect it to be below 100 fasting for an adult without diabetes. And that's page 499. Can food and liquids be altered for patients with trouble swallowing? What are the 4 different texture levels? Yes, we definitely can and do alter them at texture levels for patients who have trouble swallowing. You can find the different levels on page 501. Liquids can be thickened to help prevent aspiration. Solids can be ordered at 4 different texture levels. Level 1, pureed, which is a pudding texture. Level 2, mechanically altered, is moist and minced to 1/4 inch maximum. Level 3 is advanced, moist and bite-sized, no hard or crunchy foods. And level 4 is regular, all foods. How should the nurse position the patient when preparing to insert an NG tube? We're going to find this information in the skill 27.2, inserting a nasogastric tube on page 504, planning number 3. Gather all equipment needed. Position patient with the head of the bed elevated 30 to 90 degrees. Raise the head of the bed to a working height. What needs to be assessed prior to feeding or administering medications to a patient through a feeding tube? When would the nurse delay feeding? We can find this information on page 507. Before feeding or administering medications, measure the amount of residual fluid in the stomach. If a continuous feeding is in progress, stop the infusion before checking for residual volume. Use an irrigation syringe to withdraw stomach contents. If the residual volume is greater than 500 ml or per your agency policy, replace the withdrawn fluids, document the residual, and notify the RN and primary care provider, and delay any further feeding for a specific period of time if the facility policy states to do so. Keep your patient's bed elevated at least 30 degrees at all times if the patient is on a continuous feeding to facilitate stomach emptying and prevent aspiration. And that's page 507. Buddy! What is the recommended amount of time for administering an intermittent tube feeding? So you can find this information on page 510 within skill 27.4, administering a nasogastric, duodenal, or percutaneous endoscopic gastrostomy tube feeding. And this is going to be on page 510 under 4 intermittent feedings, number 7. Pinch off the tube and pour the formula into a gavage bag or the barrel of a syringe, keeping it no more than 18 inches above the level of entry into the stomach or intestine. If a gavage bag is used, fill it to the prescribed amount of formula and regulate it to run in slowly over 30 minutes. The formula should be given over 10 minutes or longer. Gravity pull will draw it in. Flow can be regulated by raising and lowering the container. So 10 to 30 minutes. Why does the nurse leave the patient with the head of the bed elevated after administering a tube feeding? So we kind of already answered that in a previous section, but you can also see that on page 509 under that same skill, 27.4, planning number 3. Elevate the head of the bed 30 degrees. Elevation allows gravity to help the flow of the formula into the stomach and thus prevents reflux. This position should be maintained for at least 30 to 60 minutes after the feeding. How often should the flow rate be checked when administering TPN? You can find that information on page 512 in table 27.4, monitoring peripheral parenteral nutrition and total parenteral nutrition. Under item to assess, it says flow rate, and then it says when to assess is every 4 hours. So you should be assessing the flow rate on your TPN every 4 hours throughout your shift. What should the nurse do if she checks the patient's TPN and finds it running 500 mLs behind? That's on page 512. It's going to be in the bolded text. Never attempt to catch up if the rate has slowed. The rapid infusion of glucose can be harmful to the patient. Instead, you would document that discrepancy and immediately report it to the charge RN and the doctor. They will give instructions on what to do next. If a patient on tube feeding reports nausea to the nurse, what should the next action be? We can find that information on page 512 in box 27.3, Principles of Tube Feeding. If nausea occurs, stop the feeding and notify the primary care provider. What steps need to be taken prior to removing an NG tube? We can find that information on page 509, steps 27.2, nasogastric tube removal. You can find that in numbers 1, 2, and 3. Check care provider's order sheet for the order to remove the NG tube. Assess the amount, color, and character of drainage in the suction canister. Explain the procedure to the patient. How should the feeding tube be positioned on the patient when not being used? You can find this information on page 513 in the patient education blue box, patient with a nasogastric or intestinal feeding tube. Tape the tube to the nose or face and attach it to the gown or clothing so that it does not hang lower than the stomach or key point of entry onto the patient's body. And that's page 513. Chapter 28, Assisting with Respiration and Oxygen Delivery. What is the relationship between volume and pressure in the thoracic cavity during inspiration and expiration? So again, this is going to be a review from Structure and Function, and you can find this information on page 517. The diaphragm beneath the lungs moves, causing enlargement of the thoracic cavity. Because of the negative pressure within the cavity, inspiration, which is the movement of air into the lungs, occurs. When the diaphragm muscle relaxes, the thoracic cavity space is decreased, and air is forced out of the lungs in expiration. This is the movement of air out of the lungs. Define hypoxemia. That definition can be found on page 518. The decreased amount of oxygen in the bloodstream is called hypoxemia. Where should the fist be positioned when performing the Heimlich maneuver? You can find this information on page 522 in skill 28.2, administering abdominal thrust or the Heimlich maneuver. You're going to find this under action number 5. Place the hand slightly above the umbilicus and well below the sternum with the thumb of the fist inward. This locates the correct position for thrust delivery. Refer to BLS CPR protocols. What do you do when you find a person who is unresponsive? We're going to see that information on page 523, skill 28.3, cardiopulmonary resuscitation. Cardiopulmonary resuscitation must be started whenever someone is found in respiratory or cardiac arrest. This means without breathing or without a heartbeat. It is vitally important to call for help while beginning to assess the victim. The following method is appropriate for adults. Shake the victim and shout a name. Are you okay? Call for nearby help. How would the nurse instruct the patient to perform forceful exhalation? We can find that information on page 521. Although forceful exhalation can be used with patients who are lying down, it is more effective in the sitting position. For forceful exhalation, the patient takes 2 deep breaths, inhales deeply again, then rapidly and forcefully exhales with their mouth open. This moves secretions up the bronchial tree. Repeated forceful exhalation can bring secretions upward to a point where they can be more easily coughed up. When is the best time to schedule postural drainage? You can find this information on page 525 under postural drainage. Best results occur when the procedure is carried out in the morning and 45 to 60 minutes before a meal. A patient with dry mucous membranes would benefit from what type of oxygen administration? That would be humidified and oxygen, and you can find that information on page 526. Another disadvantage associated with the use of gas is that it dries the tissues of the respiratory tract. Until moisture is added, the dried tissues can become cracked and provide less resistance to infection. The pieces of equipment needed for oxygen therapy are the oxygen source, the flow meter, the humidifier, which is the device supplying the moisture, the tubing, and the appropriate appliance for the method ordered. Page 526. Are there limits on the amount of oxygen that can be safely given to a patient with obstructive disorders like COPD? Yes, there are. You can find that information on page 529. It's going to be in the safety alert, the QSIN box, QSIN consideration safety. Safe oxygen flow rates. Patients with obstructive lung diseases should be given only 2 to 3 liters per minute because higher concentrations of oxygens can reduce the respiratory rate. This is because their incentive to breathe comes from lower oxygen levels rather than a higher carbon dioxide level in the blood. These patients commonly have a continuously high level of carbon dioxide. Check your orders for oxygen carefully and always verify higher oxygen flow rates with the prescribing care provider. Page 529. When performing percussion to loosen a mucus plug, where would the nurse place their hands? You can find this information on page 525. Secretions and mucus plugs may be loosened by percussion of the chest. Percussion is the rhythmic clapping with cupped hands over the thoracic area, but not over the spine or sternum. After percussion and postural drainage, the patient is assisted to cough effectively and expectorate the secretions. Which oxygen administration device would allow delivery of 40% oxygen? You're going to find this information on page 531 in table 28.3, Advantages and Disadvantages of Common Oxygen Administration Devices. In this table, you will be able to see that the Venturi mask can deliver a concentration and liter flow on the mask available for 24%, 28%, 31%, 35%, 40%, and 50% oxygen. So the Venturi mask is the only mask that's able, or one of the only masks that's able to deliver 40% oxygen. What are pharyngeal airways and which patients would benefit from these? So you can see this information on page 532. Artificial airways are used for several purposes: to relieve an obstruction, to protect the airway, to facilitate suctioning, and to provide artificial ventilation. There are 2 types of pharyngeal airways: the nasopharyngeal airway and the oropharyngeal airway. These are used to keep the tongue from falling back into the throat and are frequently required for postoperative patients until they have recovered from anesthesia. These airways are used for patients who can breathe on their own. However, you must never leave the bedside of a patient with this airway in place. Page 532. What should the nurse set the suction pressure to when preparing to perform oral suctioning on a patient? We can see this information on page 533, and it's going to be in the bolded text. The suction pressure should be set between 80 and 120 millimeters per mercury. Oral suctioning is usually tried before nasopharyngeal suctioning because it's a more comfortable procedure for the patient. How should the nurse prepare to perform nasotracheal suctioning? To perform nasotracheal suctioning, we're going to look at scale 28.5, nasopharyngeal suctioning on page 534. And you're going to want to look at numbers 6 and 7 under implementation. Put on sterile gloves, or one sterile glove on the dominant hand and a non-sterile glove on the other hand. Pick up the sterile catheter with your gloved dominant hand and attach the suction port to the tubing, to the connecting tubing held by your other hand. When caring for a patient with a tracheostomy, what should be completed prior to deflating the cuff? So when caring for a patient with a tracheostomy, you would always want to perform pharyngeal suctioning before deflating the cuff. And that's on the bolded text in page 533. What are some oxygen therapy safety considerations to educate your patients on? So we're going to find this on the page 527 in the QSIN Considerations Orange Safety Alert box, Oxygen Therapy Safety. And you would want to pay close attention to the bullet points to check all the electrical devices for frayed wires and confirm that they are in good working order to prevent any short circuit sparks that could cause a fire. You also want to take note to the bullet point, assess for dry mucous membranes, indicating a need for humidification to prevent tissue breakdown and increased risk of acquiring an infection. It's page 527. For the patient on a water-sealed chest drainage system that is on low continuous suction, should there be bubbling in the suction chamber? Most often, yes. And you can find that information on page 538. The disposable chest drainage unit has a suction control chamber to prevent excessive negative pressure in the pleural space, as well as a water seal chamber and a drainage chamber. If suction is used in the water seal system, there should be constant bubbling in the suction chamber. There is also a waterless system that uses a one-way valve in the suction chamber. How much fluid should the nurse encourage the patient to drink to help thin their respiratory secretions? We can find that information on page 540. Encourage fluid intake of 1,500 to 2,000 mLs per day to help thin secretions. What is one way the nurse can promote safety when caring for a patient with a chest tube drainage system? We can find that information on page 538, steps 28.1, or skill 28.1, maintaining a disposable water seal chest drainage system. And it's going to be under action number 4. For safety, we can tape all connections, which will prevent any accidental disconnection. What stimulates the cough reflex? So we're going to go back to the beginning of the chapter for this one on page 517. The mucus and cilia propel the foreign substances towards the entrance of the respiratory tract. The cough reflex will work to expel those secretions. So what stimulates the cough reflex? That would be the mucus and the cilia propelling foreign substances towards the entrance of our respiratory tract. And define stridor, you can find that definition on page 519. Stridor is high-pitched, harsh, and musical sounds on inspiration that can sometimes be present with a respiratory or an airway obstruction. And that will conclude the review for F2 Exam 2. If you have any questions, please reach out to me, and I will be posting the answers to the pre-tests for these chapters at a later time. Thank you.